Family Guy done. American Dad done. The Cleveland show is up on the chopping block. Today, we're going to take a look at some of the strange and crazy medical type situations from the Cleveland show. From the wild imagination of Seth MacFarlane comes about Cleveland Brown from Family Guy getting his own spin-off. Before we get into it, my name is Dr. Jordan Wagner. I'm an ER doc that deals with every medical situation you could think of, from gunshot wounds, COVID, broken hips, firework mishaps. I've created this channel to answer the medical questions that I get from people every single day. If you find this video helpful, please smack that subscribe button and turn your bell notifications on. That way you learn when I post a new video. All right, ready to watch some fun medical clips? Let's react to the Cleveland show.
Duck in your butt.
Oh, jeez.
Then I'm gonna put a chicken in the duck's butt.
What was he even saying? Uh-oh. Getting attacked by it looks like a turkey, not a chicken.
I suspect
Whoa.
foul play.
Oh, whoa. Gunshot wound to the abdomen. Usually if you're hunting that type of animal, right, you're using a type of shotgun, spreads out pellets. So puncture wound, stab wound, they're all treated the same in the emergency department when it comes to intra-abdominal. Basically, once you're stabilized, get your blood pressure under control, get your breathing under control, if you need to be intubated or not. And then your question is the blood pressure dropping? Is there a vessel injury? And then you need to go to the operating room for what's called exploratory laparotomy that a trauma surgeon is going to open you up, literally, and check to see if the bowel is injury, an organ is injury, or any vascular injuries, and they need to fix them to help save your life. All right, we're at the hospital now. All right, so he's got a breathing tube, he's on the ventilator, so he must have had surgery, right? He wakes up with a tube in his mouth. So this happens all the time. People freak out when you have a breathing tube. I would too, because you can't talk, you feel like you're choking, but you just gotta be calm. And if you're okay, basically what we'll end up doing is deflating the balloon and then take it out. Your patients will cough it out, and that way they can breathe on their own.
Doctor, you can stop lighting matches under his elbow. He's a
No, doctor, that is not appropriate at all. Okay, it looks like a doctor. He's got a nice white coat and his tie on, but he's lighting a match under the person's elbow. No, you don't do that. You do sternal rubs. Basically, you rub on the chest. Sometimes you can push on the fingernail. You can gently just shake the person and then escalate to try to wake them up with a little bit of pain, but not like that. That's horrible.
Dad?
No, Mr. Brown.
And you can talk with the tube in, kind of, but not as much as he's doing right now.
Luckily, your many layers of stomach fat slowed the bullet before it finally lodged in the
Oh
part
my
of your
gosh.
liver that's already dead. If you were shot 3 or 4 inches to either side.
So depending on the bullet, the velocity, grain of gunpowder is in there, it all depends on how fast it's going, right? And so this doctor is telling him that the bullet is slowed down because he's fat, or he has too much of what we call adipose tissue, is with fatty tissue, and slowed down and hit his liver. And then he's already telling him that his liver is dead. So people have bad livers or cirrhosis. This is great writing. This is hilarious. So he pulls out his ET tube, or his endotracheal tube. And I just love that it's like a clown trick where he just keeps pulling it out, pulling it out, pulling it out. That was really funny.
Right. Now I know what it feels like to be
that's
hunted
horrible.
and shot. Those poor gamblers. Killing turkeys is wrong, except in cases
that's
of
horrible.
rape and incest. We need to stop this. Let's go, Junior.
Wow, that's a little wrong. Some of the medical stuff is pretty accurate. And yeah, so if you get shot on the right upper quadrant, you have your gallbladder and your liver right there, and then a lot of intestines and your kidneys behind that stuff. But a lot of that's protected by your rib cage. So if it's lower than your rib cage, it's most likely going to hit into your intestines. But different trajectories. He was on the ground and kind of an upward trajectory of the bullet. Pretty crazy. Okay, all right. So they're at marriage counseling, Dr. Nurse.
But what Donna is saying.
So doctor could be a psychiatrist versus a psychologist, counselor. PhDs also are doctors.
9-0.
This is horrible. All right, you don't want to be competing with your significant other 9-0 when you're actually trying to have counseling between the two of you.
I sense your frustration, Cleveland, but Donna wasn't asking you to.
I definitely like the stereotypical psychologist, psychiatrist kind of situation, very stern and serious face and showing no emotion in this situation. They're humans, they have emotion, believe me.
Your vows so you could change the parameters of your marriage. She was asking you to reaffirm your love and commitment to her.
Word for word, that's exactly what I told her.
Cleveland, I believe that you never heard Donna say that.
Yeah, I finally got on the board.
Because you were not listening to Donna.
You got a slappable face, you know that?
I understand marriage counseling is stressful, Cleveland, so I'm gonna write you a prescription.
Come on, please. Daddy needs some Xanax.
So Xanax is alprazolam and is benzodiazepine. It's basically an anti-anxiety medication, or anxiolytic is what we call it. And there's many different types. You got Ativan, you got Xanax, you have Valium, you got Klonopin, all of these. So you got to be really careful. They're very addictive and they can sedate you. So you got to be really careful with driving a car, machinery, all that stuff.
You messed with the wrong scalp, lice. Now you better.
Oh no, lice. Hopefully nobody's ever had lice. Little bugs that in your hair and your scalp, and they lay eggs, and you can pass it along to anybody else pretty easy. Literally, when somebody comes to the ER, it's like code lice. Basically, everybody's putting gowns on, you're put in a room, and once you're out of that room, it needs to be deconned so the next person doesn't get any lice on them, because it's just like these little flying bugs that you can barely see.
And then.
Whoa. That's right. Oh,
Rollo, wake
3
up.
hours to get a
I
piece
have
of
to
lice
tell you
out. Ah.
something. It's not easy for me to say, and it's not gonna be easy for you to hear.
Roberta's really my mom?
Never say that again, baby. We're
Should've
gonna
cut her
have to
hair.
shave your head.
Yep, see? Told you.
Roberta, we got a runner.
It's common. This is so funny. All right, no joke. Okay, we're going to talk about the tasers real quick. So people get tased by the police and they actually come to the emergency department. So we actually have to take these tasers out because they have a barb in them and you can't just like rip them out. You'll rip tissue. So we need to actually almost like surgically take them out. We use a scalpel and cut the tissue that's stuck on the barb to get them out. And then we give them back to the police because they need them as evidence. Oh, geez.
Damn wig is itchier than the lice. I don't know how Nathan feels.
I love the wig. It's hilarious. It's pretty crazy. Sometimes we actually end up having to even shave somebody's hair in the emergency department if it's that bad. Trust me, it gets that bad.
I'm not 21. Plus, I'm on allergy medication that shouldn't be mixed with alcohol.
Ah, good. So one, he's below age, shouldn't be drinking alcohol. But then also, different medications are metabolized by the liver. So when you're using or drinking alcohol, it affects the normal chemistry and the functions of the liver, which then could mess with medications that you're taking. Uh-oh, what's gonna happen? What?
I'm sorry.
What?
He's dead.
Oh my gosh. So sometimes mixing alcohol with different types of medications could basically kill you. I'm talking mixing it with an opiate, mixing it with a benzodiazepine, basically sedatives or things that slow your respiratory rate. There are so many times that I've had people just so intoxicated that I had to put a breathing tube in them until the body's able to metabolize the alcohol off. There's not any really way to specifically speed that up because it's already in your bloodstream.
Junior, please don't leave me.
Okay.
Oh, I love it. I love it. All right. I'm glad he didn't die from the mixing of his allergy medications with alcohol, but you got to be really careful and know what you're taking and look at the side effects and look at the interactions and the contraindications on the medications that you're taking to make sure that different meds don't interact with each other as well as alcohol mixing with your medications. Oh, no! Whoa. I don't know if he's impaled by the tree, but the tree just busted through the house. Whoa.
And that's the way it is.
I love it. Just say just waterboarded by nature. That's pretty funny, but not cool. Hitting the body, maybe hitting the head, hit the back of his head on the ground. He's got a concussion, confused. This happens commonly. Basically, you should probably go to the hospital, get CT of your head, and you can have something called post-concussive syndrome that can last weeks to months to even years from head trauma.
He thinks he's Walter Cronkite again.
From Dallas, Texas, The Flash, apparently official.
I thought I was just
President
rambling, still
Edmund
rambling. Oh
Fitzgerald
my gosh.
Kennedy died at 1 p.m. Central Standard Time.
All right, good. Trying to get the tree off. It's impressive because it's got a crush injury, right? So you can be crushing the body. I love it. It's a Family Guy.
Countdown ladies, sing this song.
Oh, jeez.
The countdown racetrack 5 miles.
There I am.
All right, so besides the tree just laying on him, hopefully not impaled, it's just basically crushing his body. You can have muscle breakdown from being pressed that long. Your CK level, so creatinine kinase, you check in the blood, and it can cause renal failure or kidney failure because it blocks the normal function of the kidney. It's really bad. People actually who do like CrossFit can potentially get that as well just because you have a muscle breakdown down from hard workouts, that sort of stuff. Then I just like at the end, you re-hit somebody in the head to knock them out of the basically concussion and altered state that they're in. We don't do that. Anybody who comes to the ER who's altered, you're checking certain things, blood sugar, a tox screen, making sure your temperature is not abnormal. And then obviously you're getting images and giving them potentially different medications that might help. Sometimes even infections will cause somebody to be altered. This is actually the first time I've ever seen the Cleveland show. It is hilarious. I'm a huge Family Guy fan, so this was a lot of fun to watch and check out, and pretty ridiculous medical scenes, but I loved it. Do you have a favorite show that features medical situations that you want me to react to? Let me know which show or episode in the comments below. And if you want to see me react to video games, check me out on Experts React series on Gameology right here. And as always, make sure you subscribe if you want to see more fun videos like this one. Thank you so much for watching, and stay healthy, my friends.